Thank you. Good morning to everybody. This is Flashpoint, Liberia. It's getting better. And I'm David Coty. We're here again, as usual, on every Friday to do your program to help you help yourself. We deal with medical people here mostly. Sometimes we bring in politicians. But most of my guests are medical practitioners because we want to help you help yourself. And so today, I have brought in again Mrs. Reed. You'll notice I bring certain people here from time to time because of what they do. This clinic is an acupuncture clinic that treats over 47 different illnesses according to the WHO. That is what acupuncture does. Even though they don't do all of the 47 here in Liberia, but that's what the WHO says. It recognizes 47 illnesses that acupuncture can treat. Today we're going to be general. When Mrs. Reed comes here, sometimes I select certain topics. Sometimes I say, today we're going to talk about arthritis. Today we're going to talk about this. But today will be general to talk about almost everything that they do there. So Mrs. Reed, welcome again to Flashpoint.
Thank you.
All right. And let me inform the public that we're now going big. When I say going big, when you check on my personal page, David Coty's page, those of you who are my friends, who are following me, I have gone to 5,800 followers now. And then we're also on Flashpoint. We're also on Let's Build Liberia and on YouTube. And so when you advertise with us, you're okay. Let's talk about your activities at the clinic. Before we go into specifics, what is acupuncture? What does it really do? How do you administer acupuncture?
Acupuncture. Thank you for the opportunity. And I want to tell the general public, excuse the poor quality of my voice.
That voice is good.
Acupuncture is a Chinese treatment that we do for varieties of conditions. Acupuncture is done in a way that we insert 5 needles to certain nerve points to treat various forms of illnesses. And the nerve points that acupuncture is administered on are called acupoints. And the acupoints are located along the nerve pathway that are called meridians. And there are about 12 to 14 different types of meridians. And along the meridians, the acupoints are located. There are more than 300 different types of acupoints on the human body. Yes, and you select the acupoint depending on the condition of the patient or the illness that you are treating.
Okay. We'll come to some details. Now, the first time I saw acupuncture being administered was when your husband, Dr. Reed, John Reed, was administering it on Senator Moto, right in his house on the airfield. Now, I saw so many needles on the body, too many needles. Are they not painful?
No, acupuncture is not painful. It's relatively not painful. Even though we use the needle to prick the skin, but it's not painful as compared to when you are giving injection or when you are ordinary pain is pricking the skin. Acupuncture, the only thing you feel is that when the needles are inserted, you will feel a sensation, a sensation that is called chew sensation. And this sensation is like a jerking-like sensation that you can feel.
All right.
Yes. Okay. So it is in general, to answer your question, no, it is not painful. And you will see the needles are plenty, are many, because you are inserting the needles to more than 2, 3, or even 10 acupoints at a time.
Okay. This acupuncture treatment was invented in China. And the Chinese people say that it treats over 300 different illnesses.
Yeah.
But the WHO recognizes 47. How realistic is this?
It is realistic because for WHO, whatever they approve of to be a form of treatment, they got scientific principles that are guiding it, or they got evidence that yes, this the method can be used to treat illnesses. So it is realistic, and it is realistic also because the few illness that we treat at the clinic, they are very effective. When you're treating acupuncture with you're treating patients with acupuncture for these illnesses, they are very effective. So we can say it is realistic.
Well, you treat so many different illnesses at your place: migraine, headache, arthritis, numbness, and this, that. But why is your clinic known as the stroke clinic or the pressure clinic? Why?
It is known as the pressure clinic. The reality of the matter is the hypertension, what we call pressure, is you will not see many patients with acupuncture or with hypertension in the clinic or with pressure in the clinic until it has reached to the stage that it has complicated into another thing. Because for hypertension, it's a silent killer. So for the ordinary Liberian or the ordinary layman, when they see patient who got stroke, they think that pressure will give you the stroke, even though there are other contributing factors to stroke, but they see that the pressure that gave the patient stroke. And most of the patients that we see at New Hope Clinic, they are stroke patients, and they respond very well to the acupuncture treatment and the Chinese medicine that we use there. So most of those boys will say, well, that clinic part, that pressure clinic, that they can treat pressure, and that's how they get the directions to the many patients that can come. And they say it's pressure clinic because we treat pressure there better, but most of the patients there, they are stroke patients.
I think it is simply because when people have failed in other places, it is your clinic that will make them give it back alive, new hope.
More especially when they are failed until the stroke and those kind of area, yes.
Okay. Mm-hmm. Now let's be a little specific now. We were talking about general issues. We're going to be talking about general issues today. Let's touch one major issue today. We'll come to other ones. I saw a good friend of mine. He's a former representative like myself, who was dragging his leg the other day. I said, my man, what's wrong with you? He said, my man, my knee. He said, I said, but that thing must be arthritis. He said, yeah, but I've been taking all kind of medicine, no ways. I recommended him to you. Tell us about arthritis. What is arthritis?
Arthritis actually is related to joint pains, joint problem. Any joint in the body that is painful, that is inflamed, is swollen up, is caused by arthritis, mostly arthritis. And there are different types of arthritis. So sometimes the arthritis may affect the knees, maybe the ankle, maybe the waist or the shoulder. But in reality, the joint will be painful, and it will be stiff, and it will be swollen. That's what happens in the case of arthritis.
Is it age related?
Yes, it is age related. Even though young people can get arthritis, but arthritis comes along with the age. Once you are advancing in age, you are in your 50 going to the 60 to the 70, that's when you have more people coming down with arthritis. So for instance, if you get 10 or 20 persons here, maybe 20% in this group that are young from 35 to 20, then you got another 20% in this group that we say, okay, if from 70 to 50, the 20 people which are from 50 to 75, you will find more people there with arthritis than the 20 people that you got from 20 to 35. So it advances as age advances.
Now let's advances. Yeah, thank you. Let's talk about lumbago or lumbago, one of them. That is lower back pain.
Yes.
Well, is that part of arthritis also? You know, sometimes you wake up in the morning, man, when your twist is like your bone is breaking in the back.
Yes, like I said, we're not discussing arthritis in detail, but there are different types of arthritis. Okay. Lumbago is one of the group too.
All right.
Yeah, it affects the back, more especially the lower back. And those are things that respond very well to acupuncture. Even if you don't give the person some Chinese medicine, when you really put the points that are involved on, or you put the needles on those points that are involved, and do the person a good massage with maximum, the heating, the person will feel so good.
Millions of people around the world today are disabled permanently. Some are in wheelchair now for life. Some who don't have wheelchair are just lying down somewhere for life. And that is simply because of stroke, another major issue. Tell us a little bit about stroke. Now, before you answer that, the program you're following is Flashpoint on ELBC 99.9, and I'm David Cote. My special guest today is Mrs. Helen Reed, head of the New Hope Clinic, in Soul Clinic in Paynesville. She doesn't like to be called a medical doctor, but what she does is even more than being a medical doctor. Her husband used to be. After the husband died, she took over the clinic, and she went to China for training for many months, and she's back taking care of the clinic. Now, what is stroke all about? What happens? Or what gives people stroke?
Stroke is one of the leading causes of death, or I can say paralysis, or when the patient is not able, your mobility is restricted. The person is not able to move. Yes. And stroke occurs, actually, is cerebral vascular accident. An accident that occurs in the brain.
Okay.
It occurs when the blood supply to the brain is not sufficient, or is cut off. Yes. It happens either if there is a blockage to the vessels that supply the blood to the brain, or if the vessel is ruptured. When the vessel is ruptured, there is a bleeding in the brain, and then the blood supply is not reaching there, and no blood supply reaching there, oxygen is not reaching to the brain, and then you have stroke. If it is black, it is not rupture or burst. If it is black, then of course the blood supply will also be cut off. And there are three major types of stroke. Yes. You have the transient stroke, the stroke that just occur, and then the blockage occur, and then it's relieved maybe within a few minutes or a day or so.
Okay.
Yes. And that will not last long, but it's also a warning sign. When it happens, you should also be careful to go for medical checkup and know what is happening in your body. We also have the transient ischemic stroke, where the vessel is black. It may be for weeks, it may be for months, but it's not very severe, like if the vessel is ruptured. That is a type of stroke, and it can be treated, it can be taken care of by the acupuncture and some Chinese medicine.
Okay.
Yes. And you also have the hemorrhagic stroke,
Okay.
where the vessel is ruptured and there is a bleeding in the brain. And the goal of that treatment is to arrest the bleeding that is in the brain, which acupuncture can also do. You can do some head acupuncture, you can give the person some Chinese medicine, and then the person, the bleeding can be arrested, and then you can start to treat to disperse the bleeding on the in the brain, and then you can also treat for for recovery. You can give some apoplectic recovery pills.
Okay.
Yeah, so those are the types of stroke.
Yeah.
And those type of stroke are treated at New Hope Clinic with acupuncture.
Okay.
Yeah, acupuncture and some Chinese medicine.
All right. Now, we will come to other details about stroke. We'll stay interested in that. But let's talk about this other major issue called migraine headache. What is it all about?
Now, I want to say something else about stroke quickly before we go to migraine headache.
Okay.
And the thing about it is that stroke is a complication of some underlying condition.
Okay.
So to treat stroke, when the patient comes, we when they do the registration, we assess the patient and then we do some laboratory work to know, to check the patient to know what is the cause of the stroke. Sometimes it's from when the immunity is compromised. Sometimes it's from most time it's from hypertension. Sometimes diabetes, and sometimes other conditions. So when you have stroke, it's good to know what is the cause of the stroke.
But let me ask you one other quick question on the entire clinic issue before coming back to migraine headache. I have been present at your clinic before. I myself took my acupuncture treatment there before. Are you very expensive? I'm asking because I have seen people who were dragged there. They could not walk by themselves. They were brought by care taxi. You had to put them in a wheelchair from the outside of the door straight into the place. Now, some said they went around to many places and could not get treated. I can give one example, the pastor who went all the way to Ghana and came back. And many other examples, even like the CDC Pape, who was even in coma, totally in coma. His people thought he was dead. The Madingo people don't waste time with their bodies. They almost bury him. But for some reason, they said, let's wait. That man was brought back to life by you. When you do those miracles, this is why you call your place New Hope. You give people new hope. But are you very expensive? Tell us the truth. How expensive are you? How much do you charge? Let me put it that way. How much do you charge for treatment?
The treatment is not very expensive.
How much do you charge for treatment?
When you talk about charging, it's difficult to sit on the radio or on the phone and say charges, because you charge according to the patient's condition.
Okay.
And the right thing is the clinic has a financial person that is capable and trained for that to give the charges. The only thing I can say on the radio is registration. I know it is $15, 15 USD, or it's equivalent in Liberian dollar.
Okay.
But depending on the patient case, then what kind of medication we're giving the patient, how long the treatment will be, and all of those things. When we arrive at those things, we arrive at the diagnosis and those things, then they will place a charge according to the patient condition. But it is not very expensive. It's something that people can afford. When you compare it to life-saving situation, it's not expensive. Yeah.
Now, what are those signs? We're still going to go back to stroke. What are those signs and symptoms that people should see and say, a lot of this thing is leading to stroke? Let me do something quickly. What are the signs and symptoms?
Signs and symptoms of stroke. Signs and symptoms of stroke. When you have a pressure that continues to go up, you must be careful. Take your medication. Do further investigation on your pressure. It may lead to stroke. When you have, when there is a time that you can't remember things that you're supposed to remember, and you can't remember it. Like, for example, somebody that you know very well, they come, they say, oh, good morning, and you can't remember to call their names. And now somebody where you just know a few days ago, you can't remember to call the person's name. Be careful and do a checkup. Some people forget their children's name, children that live with them, or their own children. When they come now, they say, that Paul, then they start mixing the name. Be careful. It's better for you to check.
If you can't remember too
if
well.
you can't remember too well. I remember this incident of a lady that somebody that we always together, every day we do ministry together, and we were supposed to pick her up from a particular junction. When we came to the junction, she saw the car passing all over for her to say, stop, holy. She remembered to say, now or nothing, she just hear, hi. But then when we look across the road, so we say, oh. So when we stopped the car, we asked, she said, I couldn't remember anybody name. I couldn't remember to even say stop. I just was hearing hi.
Okay.
That is a sign of stroke.
Okay.
The person need to be careful. When the stroke has occurred, you will see that the person's mouth is twisted.
Before you go to the twisted mouth, I was sitting on my porch the other day, and I wanted to go pick up something from my room. But when I got into the room, I forgot. I said, "But what brought me here?" I came back outside. Then I went back to pick up what I went for. Is that a sign of stroke?
Yeah, it's a sign of forgetfulness. So you check you check your memory. You check
So
your
not every
memory.
forgetfulness can lead to stroke.
Yeah,
Not all can lead to stroke.
not all can lead to stroke,
Okay.
but it's also one of the signs.
Yeah.
Yes.
Especially if it is repetitive.
Yeah.
It happens all the time.
All the time.
If it happens today, that's a different thing.
Mhm.
But every time you
Every
forget
time.
it, you gotta
And
go
things
check.
that you shouldn't be forgetting.
Yeah.
But this, if you wanted something outside, or you wanted to say something to somebody, and you call them, when the person comes, you say, "Oh, I just forgot." It may not be a sign of stroke. It may be that you got too many things on your plate, and you thinking on too lot of things. So that could also be responsible for that. It may not be stroke.
What about numbness? Is that a sign of stroke? Your whole
Numbness,
face
I
and
would
muscle.
believe numbness to be a sign of arthritis mostly. But numbness on the face, more especially on one side of the face, yes, yeah, you also need to check and do some examination.
I'm asking that because Mr. Riley, who was one time an official of the FDA,
Yeah.
I'm calling his name because he wanted a song.
Yeah, he
When the man-
came to the radio anyway.
Yeah, he told me I must appear to testify, to let God know, let the whole world know what God has done for me.
Yeah.
Mr. Riley was driving one time, the mouth turned on one side, twisted on one side, and then he didn't even know, he just felt some numbness until he gave somebody a little look at the bump and said, "But please put me down." They were afraid of him. What, is that a sign of stroke too? Your mouth just been twisted on one side?
Yes, the mouth is twisted. That is wind stroke.
Wind stroke, okay.
Wind stroke does that. The person's mouth will be twisted, even though their extremities, the upper and the lower extremities may not be weak, it may not be paralyzed, but the person's mouth may be twisted.
Okay.
That is wind stroke. And sometimes they affect the voice too.
Yeah.
The voice quality will be poor.
Yeah.
The person will not be able to talk and pronounce words clearly.
Okay. So that's another sign of stroke when you can't speak. Your speech is sluggish.
Yes.
Okay.
Some people, their extremities will be okay, and everything else. The only thing is they say the person can't talk. They can't talk good, and then they bring them to the clinic. That's a sign of stroke.
What
Because stroke happens in the brain.
In the
And
brain,
in
okay.
the brain, there are many centers. The sight center is there, the hearing, the speech, and every other thing. So depending on which center is affected, you will see the effect on the person. If it is sight, some people get stroke, they can see clearly. Some people get stroke, they can hear.
And one thing I noticed about your place, or acupuncture, I remember a lady went for treatment for a particular purpose. I think the arm was not moving too well. But she could also not hear well. But when you went and treated the arm problem, she said to you in my presence, "Oh, but I can hear now."
Yes, she
Okay.
says she can hear now. Even when radio is giving news, she can hear the radio now. And that hearing problem has been like a year or two on the woman. And that's why she came for, actually, she very keen for, she had frozen shoulder. She couldn't lift her hand to go, and it was very, very painful. So that's why she came. But in the process, when we were treating her, when she registered for the one course of the acupuncture, and we were treating her, the hearing loss, it got repaired, her hearing got replaced. So she was so excited. She came, she said, you was inserting the needle somewhere around my ear or on my head that day. Then but I can hear now. And the woman she gave her all for me. She said she can hear. She was so happy that
She brought a lapper?
yeah. When
You still got one piece to give me?
no, I get some pieces to give you again. Yeah, good water. So she was so excited that when radio is giving news, they are making announcements, she's able to hear it, that which was not happening before. Because you see, what happened is that one point of acupuncture, this point right here, they call Hergu. Hergu is a point between the index finger and the thumb. You just measure it like that right here. This point can be used to treat a lot of conditions. It can be used as a distal point. It can be used as a local point. In other words, when anything is happening to the arm, you can use the point. When something is happening to the head, which is not the head is not round here, but you can still use it to treat the head. So one point in acupuncture and one acupoint can be used to treat some of the 2 or 3 different conditions.
Okay.
Yeah, so when we were treating her for the shoulder, some of those points were effective for her hearing loss.
Okay. One of the major reasons around the world today for divorce cases is sexual incompatibility, erectile dysfunction. Man, woman can't agree when it comes to sex. Now, what can you do, or what can acupuncture do? Most men today are facing that problem. They will get married and they will say, until death do us part. But my friend, if the man cannot continue to do his nighttime justice well, the woman will say, I'm leaving. Even though the man has built a new house for her, bought a new car, she said, that ain't enough, I'm going. You're not doing what you're supposed to do. Can you help men to solve their erectile dysfunction problem?
The answer is yes. Acupuncture can treat sexual problem. But sexual weakness or sexual dysfunction is a big topic. Yes, it's a big topic.
We'll look for time to talk about it.
We'll look for time to talk about
I'll
it.
bring you back here for
that. But acupuncture can be used to treat sexual dysfunction. But we're talking about migraine headache.
Yeah, let's go to that right away.
Migraine headache is a headache that occurs on one side of the head.
Okay.
You will see that one side of the head will be hurting. The pain range from dull aching point to severe point. From the beginning, pain will be dull, and it will just be there aching, and then it will go to the extent that it will be severe, that the person is not able to go places, the person is not able to get up to go to work. Migraine headache is related to stress. Is related to stress, more especially if there are some stressful situations, like maybe for some reason the person is very stressful, and after that stressful time they will have migraine headache. It can be triggered by stress, it can be triggered by trauma or so.
Okay.
Yes, but migraine headache can be treated successfully with acupuncture. In fact, some of the very few things that the Chinese can lay their hand on when it comes to acupuncture is things like headache, pain, toothache. Those are things that when they're ready to treat, they don't even look for different Chinese medicine. They can just treat it with acupuncture and it can be okay. So migraine headache can be treated with acupuncture very successfully.
Thank you. We'll take a short break now, and when we come back, we'll be taking your calls. There may be some of you in America today watching us on the Facebook. I remember a man whose mother had a problem all the way from the States. When they went all over Norway, they heard about you and you treated them. So you may be also in America listening right now, or Germany, or anywhere, by way of the David Cote Facebook page. And you want to get in contact with them, they're going to tell you what to do about that. But if you are sitting somewhere now, you want to participate by calling, you will not now until the break is over. You will call 0777 511 977, 0777 511 977, or 0886 511 977. Those are the numbers you're going to call to participate, to be a part of this program. You can ask Mrs. Ree any question you want to ask. Let's play our. Let's take our break.